Afternoon, Madam President. I want to start by thanking Senator Summers for taking the time to walk us through many of the sections of the bill. I think that's very, very important when you have something like this, 78 sections, and I'm getting my first look at this legislation today, not being a member of the Public Health Committee. So I really, really appreciate that. I've also gone through the summary of each section, trying to find a comfort level with each piece. And I have a few comments about some of the sections of the bill, and I also want to align my comments with Senator Wong, who made the very, very important point that while this might be an effective means to pass a great deal of legislation in a quick manner, I think it does fly in the face of the legislative process, which requires that we tackle things on a case-by-case basis. And one of my frustrations over the years in the legislature has been the number of times I'm faced with a piece of legislation where I like some aspects of it and dislike other parts of it. And I understand that that is part of the process that helps certain things get over the finish line because they might not survive on their own, but people are willing to overlook that as a small part of another larger endeavor. But I don't think that's fair to our constituents, and I would caution against it in the future. I would much rather be voting on 25 or 30 bills that represent the content of this one House Bill 5500. Even if that meant coming down on the favorable side of every one of those sections, I still think it's benefit to our constituents to know where we actually stand on each item. So, as I said, there are 78 sections in this bill. Some of them I'm clearly very much in favor of. Section 51 refers to a piece of legislation that I proposed this year, and I am happy, as was pointed out, that it ended up in this bill and will likely become law as a result, and that is a section that has to do with ending discrimination against persons with disabilities as far as organ transplants, and I think that is something necessary, and I'm delighted that that's going to happen today. I do have a couple of questions. One of the questions I have has to do with sections 74 through 77. So, Madam President, through you to the good chairman of the Public Health Committee, I just want to confirm, because I see a reference in the summary that sections 74 through 77 were taken from another bill, Senate Bill 477. And I know that there was a very large public hearing with tremendous turnout because there was some language in that bill that reflected making gun violence a public health crisis. I want to just confirm that that language no longer exists in the bill before us. Through you, Madam President.
Senator Anwar.
Thank you, Madam President. I wanted to thank my esteemed colleague for that question. Through you, Madam President, correct. It is not in this bill's language.
Senator Sampson.
Thank you, Madam President, and I appreciate that very much. And I have a question also on Section 47. And Section 47, from my notes, was taken from Senate Bill 213, which I know is legislation that has been before the General Assembly a number of times in recent years. And this is legislation that would allow medical assistants to begin administering vaccines and end the prohibition that exists in our current statute that says that only a physician may do so. I guess what I want to ask is, hopefully the chairman can make me feel better about this. I know that in previous years when this was a standalone bill, we did have a number of people come forward objecting to it, mostly nurses, of course, and we also have received a lot of emails and testimony in opposition. But this particular cycle, I see that it's been made part of this bill, and right now, I think it may be the only thing standing between me voting yes or no on this entire package. So I am just looking for some help. Hopefully the chairman can reassure me that this is something that is amenable to the community at large, and that there is not such great opposition as there was in previous years regarding this section, which is Section 47. Through you, Madam President.
Senator Anwar.
Thank you, Madam President. Through you, Madam President, I wanted to thank my colleague for this question. This part of the bill is very important. As a physician in my other life, I can tell you there truly is a need to have medical assistants be able to provide the vaccines. Especially during the pandemic, we have seen this need to be much higher. If we were to talk to pediatricians, the federally qualified healthcare centers, if we talk to the Connecticut State Medical Society, for the past 7 years, they have been coming to us throughout and asking for this bill, and they've been asking that this be provided. It intuitively makes sense. 48 other states have done this. We are the last 2 states right now, one of the last 2 states that's not done this, and we are hoping that we will be the 49th state to join the rest of the country to be able to address this. There is a need. The training is needed for safety perspective, but this is going to improve access and help. And I can also state in the 48 states, there have not been complications around this aspect, and it should be safe for patients as well. So through you, Madam President.
Thank you, Senator Sampson.
Thank you, Madam President, and I really appreciate that answer. It is extremely helpful to me. I guess I would just have one follow-up and say that my concern, well, let's put it this way. Normally when you see legislation like this where it ends up being a kind of a battle over scope of practice, and you have different interests as far as whether or not certain people at certain classification, whether it's in medicine or anything else, have the ability to do certain types of work, they naturally have a desire to preclude anyone else from entering their domain. But since there is a public health need for people to be able to administer vaccines, we've got to address that concern some way. So I would want to focus primarily on whether or not there is a safety issue here. I'm hoping the chairman can maybe describe for me what the difference in qualifications might be for administering vaccines between a physician and a physician's assistant. I know, for example, the amount of education an actual medical doctor might have to prescribe medication is substantial and way more than other folks in the other professions, in nursing and so forth. So is there something that might tell us that the physician's assistants are just as qualified in this case, or they will be pursuant to the legislation that's before us to satisfy the safety concerns that someone might have? Through you, Madam President.
Senator Anwar.
Madam President, there are 2 answers to this. One is a practical one, and which is the easier one to do, which is that yes, they are able to do it. And the other one is more of a technical one, because there is a word use supervision, and by the scope of the existing practice for a physician assistant, they are not in the position to supervise. They're usually supervised themselves. So I think that's a technical component. From a practical point of view, I do think that they should be able to perform this. Through you, Madam President.
Senator Sampson.
Thank you, Madam President, and I appreciate that answer, Ross. Thank you very much, Mr. Chairman. I appreciate those comments. I feel a lot more comfortable with the bill as a whole. As I said, 78 sections, and that was really the one that stuck out to me that I really needed to get some answers on to satisfy myself that I could indeed vote yes on it. I will just make kind of a humorous aside that I found it interesting that we are making May 5th Maternal Mental Health Day. I think May 5th will be a mental health day for many of us, particularly the people in this building who our last day of session is May 4th. But I think that's great, and I appreciate the time of the chamber, and thank you, Madam President. I will be supporting the bill before us, and I'm pleased that I can say that, because it is a rare day that you can put together something like this, an aircraft carrier style bill that's got 78 sections and pieces from as many as 20 other bills, and I find myself in a position of supporting it. Based on that, I'm going to also recommend that we don't do it. This particular case, it's going to get by me okay, but generally speaking, we see a lot of bills like this more and more, I think, as time goes on, and I do think it's a bad practice. We really should dedicate the time and energy to tackling these issues one by one. I think our constituents deserve that. Thank you, Madam President.